Even with 514 cases, John, we're still and will continue to track and trace every single one of those cases. We know where they came from, what links to overseas travel, who those individuals were in contact with. So that if someone in that contact group then has COVID, we can continue to trace the line of how people came in contact with it.
We've talked about on the programme a lot is what is going on in care homes at the moment, because it does seem that people were transferred from hospitals into care homes to release pressure on hospitals, but without being tested first. So they were, in effect, carrying the COVID-19 into places where there were lots and lots of vulnerable people.
Infections in care homes are now falling rather than rising, and everybody in a care home, whether that's a patient or indeed a member of staff, can be tested, and they can be tested whether they are symptomatic or even asymptomatic. So that's now available because we've got this big expansion in test capacity.
If we'd been doing this a little bit earlier, a lot of people might not have died.
Yes, if we had had 100,000 test capacity before this thing started, and the knowledge that we now have retrospectively, I'm sure many things could be different.
You updated yesterday evening, I think, the guidance, the clinical guidance for care homes. It still says that if someone is in hospital and is tested for coronavirus, they can go to a care home before they have the results of the test. Does that really make any sense?
So what our position is, and I have not seen absolutely yet the final updated guidance, but
it's on your website.
The policy in care homes in Scotland in terms of discharge was not different to the rest of the UK. Earlier on in the pandemic, and I remember this, I remember the sleepless nights I had. We thought we were seeing pictures from Italy at the time of hospitals being overwhelmed by COVID, and we didn't think that was the right settings for older people, particularly those who didn't have a medical need to be in hospital. So there was a concern about not having older people in hospital as there was that tsunami of coronavirus.
But why then wouldn't you? Why then wouldn't you? And this applies obviously to wherever any of these elderly patients were. But why wouldn't you then test an elderly person who was being discharged from hospital into care homes? I mean, you know, how much thinking did you need to put into it? That would have seemed self-evident that if you were worried about COVID, that sending someone home from hospital to a care home who could be infected would seed that amongst the care homes. And as we know, that's exactly what happened.
Just go to a couple of these statistics, right? I mean, you were testing people for coronavirus before they left hospital, quite early on in all of this. 52 of them who tested positive on their first test were moved within 7 days of that test into a care home. Now, these people definitely had coronavirus. We knew that that surely was a bad thing to do, putting them into the place where the most vulnerable were being housed.
Well, I'd say two things to that. Again, and I'm not trying to dodge responsibility here, because at the end of the day, I am accountable, and I have said it many times, for the actions and the decisions that I take. But those decisions around those individuals would be made by their clinical team. That is a clear way in which these things happen, and it's the right way for these things to happen. And what they would have had reasons why, even though the individual was positive for COVID, they judged that it was safer for them to go into a care home than to stay in hospital, and that the care home would have the infection prevention and control in order to keep that individual and others safe. Remembering too that what we did say early on is that people who were admitted to care homes should be getting looked after in their own room for the right isolation period. And indeed, all individuals in care homes, this has been one of the great difficulties for residents in care homes, is that we said for many weeks that they had to spend a large part of their time in care homes.
Sure, I just want to take this though back to cabinet level, because you're talking about this being individual decisions. For many weeks though, you were unaware that this virus was being taken from hospitals and put into care homes. Is that right? You were unaware of that at cabinet level, or if you were aware, you didn't stop it?
No, what I'm saying is I cannot know, not me, not the First Minister, nobody who's a member of cabinet, who's a politician, can know about the individual decisions made by clinicians with patients. Well, you know,
That policy is a basic policy.
You and I might say that now, Martin, but we say that with 9 months hindsight.